emergency department, ambulatory care, surgery services, inpatient care, ICU, diagnostic imaging, and the lab and pharmacy will be renovated. And a new parking lot, so I was only partially kidding, will help accommodate the growing number of patients in the area with space for up to an additional 500 vehicles. And I want to thank the leadership team at the hospital as well as at the Local Health Integration Network for moving this proposal forward. If it weren't for that collaboration, we could very well not be here today. Now, I know there's tremendous support for this project in the community, and of course, I'm thrilled to have played some small part in making things happen. We all in this, we're having an intense experience today. We all in this place know just how terribly important healthcare infrastructure is to patients, their families, and our communities. Our team is here, and we're committed, and we're going to get this done. We're going to make our healthcare system, your healthcare system, better than it's ever been. So this is wonderful news, isn't it? All part of our government's plan to bring the best quality of care to Ontarians when and wherever they need it. Friends, understand something. This is not the end of a journey, but the start of a bold new adventure. Congratulations and thank you to all the people whose hard work and commitment have made today possible. All the best. Thanks.
Thank you, Ted. You can hear everyone in here cheering, and I know that everyone in Burlington is cheering as well. Okay, Mayor Rick Goldring was sworn into office as Burlington's 28th mayor on December 21st, 2010. The mayor has a long history of community dedication with Burlington as a Rotarian, a member of the Ron Edwards Burlington Family YMCA board and the Burlington Chamber of Commerce, as well as a past city and regional councillor for Ward 5. Please join me in welcoming our mayor, His Worship Rick Goldring.
Well, this truly is an awesome day for the city of Burlington. We have so much to celebrate today. Citizens of Burlington have been waiting years, if not a decade or more, for this particular announcement. Joseph Brand opened its doors in 1961, and a few short years later, I had my tonsils taken out by Dr. Love in the hospital over there. Been there several times since. I won't bore you with the details, not that exciting. The size doubled in 71. There have been some improvements and renovations since 1971, but now we are ready to take Joseph Brant Memorial Hospital into the 21st century. I am extremely optimistic that the redevelopment will not only provide new bricks and mortar, but will also provide the citizens of Burlington with one of the best community hospitals in Canada, befitting a city that is recognized as being the third best city to live in Canada by Money and Sense magazine, and the second best city to raise a family by today's Parent magazine. And maybe the hospital will help us be the best city to live in Canada. So we know the redevelopment of the hospital is a high priority for the citizens of Burlington. In a City Commission public opinion survey, 7 out of 10 residents say the hospital redevelopment is important enough to be a priority in city spending. Burlington Council has shown leadership in committing a contribution of not more than $60 million towards the hospital redevelopment. And we've got a lot of work to do on the details, and we're going to roll up our sleeves and work with the hospital to get this thing done. But just to give you some background, and last year, Council voted to direct a $1.2 million from an operating surplus from the previous year to as well as a special tax levy in 2010, going towards a special reserve fund for the hospital redevelopment, because we knew this day was going to come sooner or later. A similar approach was taken this year, and at present there's over $4.8 million in that reserve funds. So we look forward to working with the hospital in order for us to iron out all the necessary details in order to realize our collective vision for Joseph Brant. There are many people I'd like to thank and acknowledge for all their efforts so far, and I recognize the journey is really just beginning. I really want to thank Eric Vandewaal for his tenacity and persistence that resulted in the announcement today. You were hired with this in mind, and congratulations on bringing us this far. But also I want to thank the Board of Governors along with the Board of the Foundation. I suggest the Foundation, your work has really just begun now. I also want to thank the staff and medical people here at Joseph Brant Hospital for helping Joseph Brant be what it is now. Obviously, we have to thank the Ministry of Health and Long-Term Care for the support so far with the project. I want to take a special moment to thank Ted McMeekin, the MPP for Ancaster, Dundas, Flamborough, and Westdale, for his leadership on this particular project. He's the MPP from the community next door, but he's jumped in with both feet in his support for this project. And last week I was away on vacation. I actually just got back last night from being away for 10 days, and it was great. Until Ted called, I had no thought of the city whatsoever. It was wonderful. But it was such a welcome call last Thursday when Ted called me to tell me about this announcement was going to take place originally on Tuesday. So I'm glad you changed it to Wednesday so I could be here. I'm sure that's not the reason, but I'll say it is. I also want to thank Joyce Savaline, who's not with us today, for her leadership on this particular project as well. I do also want to take this opportunity to thank Burlington City Council, the current council, as well as the immediate past council, led by my predecessor, former Mayor Cam Jackson, as well as former councilors Peter Tome and Carol D'Amelio, as well as my current colleagues that are with me today, as well as Jack Dennison, who's not here. But thank you very much to everybody for your leadership on this particular project. Joseph Brant Memorial Hospital is not just an institution that provides medical and surgical treatments for those that are injured or sick. This is an institution that strengthens and galvanizes the social fabric of our community. There is so much community building that takes place as a result of the people that work here, the work of the foundation, the auxiliary, along with the many service clubs and businesses that contribute time, talent, and money to a place that helps so many during very challenging circumstances. We all look forward to doing our share individually and collectively to make this a redevelopment project that we can be proud of. Thank you.
Thank you, Mayor Goldring. I would now like to introduce Helen Mulligan, who is here today on behalf of the Hamilton, Niagara, Haldeman, Brant Local Health Integration Network. Helen was appointed to the Lynn Board in June of 2010, following a 35-year career as a registered nurse. As well, Helen has served on various